Hey guys, Max here, and it is 5 days post-op from top surgery with Dr. Cori Agarwal at the University of Utah in Salt Lake City. I just thought I'd do another quick video because, well, one, I thought there was a couple things I wanted to go over, and two, I'm bored. I am so insanely bored. I've had a couple surgeries before with my hip, and after my hip surgeries, I was able to kind of, work out my chest. I could move around on crutches, and I could at least do certain things just kind of balancing on one leg. But it's kind of amazing the things that you can't do when you're not allowed to use your chest. Just little things you don't think about, just like getting into bed. You hop into bed and you slide yourself over with your arms, and you can't do that. So like I'll balance on the edge of the bed and kind of like use my legs, move over, and kind of have to shift my body around on the bed. And you can't use your arms, so it's a little weird. Also, sleeping on my back has been very frustrating. Like the first couple days, all right, anyway, so my hip surgery. I've had 3 hip surgeries. They were hip scopes. And after those surgeries, like the first 3 days or so were awful, but they'd slowly get better. After the top surgery, my first day wasn't so bad. I got out of surgery. I was insanely hungry. I ate a big burrito. I wasn't nauseous. I was eating just fine. Day 2, I stopped taking the painkillers and I was feeling really good. Now we're at day 5, and for those of you who are female to male, you guys bind. You know how it feels to wear a binder, and my other videos were talking about how it just feels like you're binding. So if you can imagine wearing your binder and sleeping in your binder, like by the end of one day of wearing your binder, it's got a lot of pressure and you start getting your shoulders sore, your back's kind of sore, and it hurts. Now imagine wearing a binder 24/7 for 5 days straight. That's kind of where I'm at right now. At first, things seemed just fine. I was a little restless, but I was feeling pretty good. But now, after 5 days of doing this, I am so very ready to have this done. The tubes for the drains, they come out underneath the vest that I have, so I keep having to shift them around. If you think about if you like hop in the shower and your feet are on the the bottom of the tub and you stand there for a second and they kind of get suction cupped on there. So then you go to pull up your foot and you have to kind of slowly peel it off, and it kind of hurts when you do that. Or even just like a band-aid, you go to pull it off and it's kind of sticky. Well, the tubes, if I wait too long before I move them, that's kind of how it feels. I'll go to try and shift it around underneath the vest, and when you go to initially move that, the sweat of your skin that's gotten stuck on those tubes, you have to kind of pull it off of your skin, and that really hurts. So it kept leaving little indents on me. So hence why they tell you to move those tubes around, like you can shift them back and forth along your vest so that it apparently there are some guys that'll go in for their 1 week and they'll actually have blisters where those tubes are if they don't move them enough. So I've been moving them around as much as I can, but like when I move them, it kind of tugs a little and it kind of makes it the incision site sore. So I don't like to do it too much, but at the same time, it gets to that point where it's kind of rubbed raw and it hurts. So I've been trying to keep those moved so that they don't end up leaving me blisters. But at the same time, some of the gauze, the padding under the vest, kind of sticks out of the one side of the vest, and it's been rubbing on the arm. And I've been kind of paranoid. Like I've heard of using baby powder to help it from rubbing, but I'm so paranoid about having the baby powder on there and getting it around those tubes. And I just really am paranoid about getting post-op infections, having anything in like affected like with those tubes. So like the thought of having these tubes sticking out of my chest, I'm really paranoid about putting anything near them. I mean, I have gotten a little bit of deodorant on to try and help me from stinking too bad. Luckily enough, I haven't gotten too smelly, and my fiance is amazing. He helped me get my hair washed, my face, and he's been using baby wipes to kind of wipe down my back and shoulders. And we kind of covered up the vest and we sprayed down my bottom half so that I was clean. So he's been keeping me in clean clothes. So that's been nice. It definitely helps being clean. Um, I guess I just wasn't quite prepared for how annoying it starts getting after a while. Because after the hip surgery, after a while, it slowly gets better and better. With this, the first couple days were fantastic, but the longer I'm wearing this vest, the more frustrated I am, and the more confining and the more it hurts. So I just thought I'd put that out there. That's something that I didn't really think about and I didn't really hear too much about prior to top surgery. Um, it's just a little frustrating not being able to do things, especially not being able to do things for myself, warm myself up food, just grabbing a drink from the fridge, opening the refrigerator door. Like these little things that I didn't think about. Like I can't even close the front door. My fiance has to do these things for me. So it's very frustrating to have to ask for help for everything. I'm a very independent person and I like to do things myself. And after this surgery, knowing that I have to have help for just about everything is very annoying. um, so today is Memorial Day. And so I have 2 days before I get my big reveal. Wednesday at 11:30 a.m. I'll go in and get this vest off and hopefully my drains will come out. So I guess you'll hear from me then. I'm gonna have my fiance try and get a video of that for my big reveal. So I'm excited. I just really want it over with. Anyway, here's my quick update of what's been going on. As always, any questions, hit me up, find me on Facebook, and I'll talk to y'all later. Bye.